Hey,
Dr. Charan, can you hear me?
yeah, I
Is
can.
it still echoing?
Um, Hello, good evening. No, I think it's not
Good
echoing.
evening,
It's
Doctor.
not echoing. Yeah,
All right, all right. That's great. That's great, Dr. Charan. I think we are good to go now.
yeah.
Yeah, okay, Dr. Charan. So I'd request you to firstly introduce yourself and yeah, then we'll be good to go.
So I'm Dr. Charan. Nothing
Yeah.
much to introduce, but I'm a neuropsychiatrist. I'm working with
Hmm.
Kim's Hospital in Hyderabad. I've been practicing
Yeah.
since this is my sixth year. I
Mm-hmm.
see all kinds of patients.
All right.
I don't limit myself to only children or adults or older population. I like to see so many patients in a day. That's something that I really enjoy. Um,
Okay. Dr. Charan, I think your video is paused. If someone can let me know and confirm. Okay, I think he is facing some network issues also. We'll wait for him to join us back. Okay, he's here. He's, yeah, yes, Dr. Charan.
Extremely sorry. It's not network.
It's fine, it's
I had an
fine. Network
ICU
issues
call.
are not in our
No, I
hands.
had an ICU call, so I had to take it. Sorry.
Okay, okay,
Yeah,
okay.
yeah. So yeah, that's about me. I think we can start the topic. We kept people waiting
All
long
right.
enough.
All right. I would like to tell my viewers at this point that Dr. Charan is also willing to take your doubts. So if you have any kind of questions related to suicide prevention or how is it that we overcome suicidal thoughts and how can we be of help to someone, then you can put it in the chat box and we would love to cater to your doubts. So with your permission, doctor, can we start?
Yeah, of course.
Okay. So, doctor, I'd like to know from you first, what does suicide exposure mean? Exposure to suicide. What does that exactly mean?
Suicide exposure means somebody see thinking about suicide or thinking about ending life is not very
Yeah.
new. It's actually very common
Hmm.
than you and me would like it to be. Most of us
Yes.
might not act on those thoughts, but we all experience this kind of thoughts. I mean, I felt at some point in my life that I can't take so much pain, might as well end it. I think it's such a open secret that a lot of people don't discuss or
Hmm.
talk about. For example, if I have a headache, I would go and tell all my friends that I'm having headache. But if I suddenly
Hmm.
get a thought that this life is not worth it, or let me end this life, I will not discuss it with anyone only because of the fear of judgment. Because at the end of the
Hmm.
day, we are
Yes.
social beings. We live in a society. We tend to mold ourselves according to how society functions. Society wants us to function. So it's a
Yes.
very hush hush topic. So I think somebody who has these thoughts or who is exposed to an act before, which is
Hmm.
could be suicide exposure.
Yeah. And you also mentioned, doctor, that it can be either hush hush, and I feel that these thoughts can also come from our unconscious, that we might not be thinking about it consciously, but they might still be there. So I'd like to know from you that are there any kind of risk factors or red flags that one can identify that are involved during us thinking about suicide or somebody else thinking about it?
See, there's a common myth that somebody mentions that I feel like ending my life. If somebody mentions it multiple
Yeah.
times, the gravity of the situation becomes less. People don't take them seriously.
Yes,
I know
definitely.
a lot of patients who come to me and they tell me that I when I ask them, can I ask you a personal question? Did you ever feel like ending your life? Before they answer, the family members say that she keeps threatening that the word they use is threatening. She or he keeps
Yes,
threatening
definitely.
that he'll end the life. I
Hmm.
think wrong usage of word, first of all. So if somebody is
Yes.
mentioning that they want to end their life, that itself is one of the important red flag. Just because they didn't
Hmm.
live up to your
Definitely.
expectation by attempting or committing the act, that doesn't mean it's not serious. People also
Definitely.
build up, they always say that weak-hearted or faint-hearted if someone wants to end their life. But actual thing is,
Hmm.
people build courage or gather courage to do it. It's not for the
Yes.
weak-hearted somehow manage to live on, right? They find solutions and
Yes.
live on. But somebody who gathers
Definitely.
courage by speaking about it or telling other people or seeking validation or support,
Hmm.
in this
Hmm.
way, I think should never be missed. I think that's the first important red flag. Second thing is somebody
Yes.
who has attempted in the past is a very important red flag. So you always have to be careful.
Hmm. Definitely.
At the end of the day, it is a medical condition. It could be because of a medical condition, right? So if
Definitely.
somebody had a stroke before, and there's a good chance they can have stroke again. If somebody is telling you that I'm
Yes.
not able to feel my right side of the limb, immediately you would take to doctors saying that probably
Hmm.
stroke is coming back, right? Same thing,
Hmm.
but
Yes.
when you talk about suicide, they immediately don't take them to a doctor or a therapist,
Hmm.
just because they think that
Yes.
it might not happen, might be just saying it, right? So I think
Yes.
when someone tells you that they're feeling like, I think that's the first important thing. Someone with a previous attempt could be another red flag. Third thing
Okay.
is somebody who is suddenly using a lot of drugs. Suddenly is
Okay.
drinking a lot. It could be following a breakup or following any financial stressor. It could be any stressor, right? Somebody using a lot
Yes.
of drugs also could be, doing this, because most of the acts are also done while they're intoxicated, because they feel like they
Hmm.
don't feel as
Definitely.
much pain. That is another
Yes.
very important thing. And somebody who is in an abusive relationship, very good chance that they would want to, especially if they don't get societal support, especially women. If they want to go out of the
Hmm.
marriage, your own parents won't support you, so forget about society. So
Yes.
very good chance that they might want to
Hmm.
end their life. Somebody who is sexually abused, etc. There are many red flags. Somebody who has
Yes.
access to any lethal weapons. In India, we don't use much lethal
Okay.
weapons. People use
Yeah.
other ways like hanging, etc. So all these can be red flags of suicide attempt.
Hmm. Okay, so I'd just like to repeat quickly. So you mentioned that either they are telling you directly about it, or they have a previous attempt, a past history of attempting the act, and then if there is any kind of drug abuse or drug intake due to any kind of stress, or they don't have any kind of support. Am I right, doctor?
Yeah.
Okay. So all of these factors, I feel that they are more observable, but as we all know that we are running in a time where everything is digitalized. We are running on social media. So I'd like to know from you that maybe there are through there are people posting certain things on their stories, their posts, they might be writing about it. So as we are more and more progressing towards social media, I'd like to know from you, how is it that we can identify someone's suicidal thoughts over social media, considering the increase in the usage of it?
So suicide is a medical emergency. Um,
Hmm.
I want people to treat it like it's a heart attack. How when somebody is having a cardiac arrest
Okay.
and they said that, and they tell on online media, social media, that
Yes.
I'm going to have a cardiac arrest. How would you respond? With
Hmm.
what emergency of the situation you respond? I think same way you should respond. So I don't
Hmm.
know too much about it, because in terms of, I don't know if our social media, for example, like I don't know if I can take names, but Facebook or Instagram, Twitter, I don't know if these handles have a suicide prevention feature where I remember
Hmm.
watching movies where people would act immediately, and most of these are from West, right? I mean, they would call,
Yes.
you know, police, and immediately cops would show up, or immediate help
Yes.
would come. I don't know if that happens in India, so we don't have such a strong
Hmm.
network system here. But
Definitely.
I'm thinking,
Hmm.
like, if it's somebody that if you see something like that, try to reach out there, to them first.
Hmm.
or if you
Hmm.
don't know them, I gave a thought about it, right? I mean, I'm not expert at this particular thing because I'm a doctor.
Yes.
So if somebody has better suggestions, please put in the comment section. It's a discussion at the end of the day. For example,
Yes.
if I'm following somebody and if I saw them post something like that, and I would go and see the tagged pictures of them, who are they mostly tagged with. You could see probably their
Okay.
friends or the spouse or
Hmm.
children or whomsoever. Try to reach out to them.
Hmm.
Leave a text to all of them. It's somewhere like you are trying to help save someone's
Hmm.
life. Maybe a stranger, but you
Yes.
can still save somebody's life. So I think reaching out to those people would help. I was looking at something from India. I would like to see if that's something that would work for us. I mean, we can't really like pull the stunt now and say it, but uh, they said that Facebook has a suicide prevention feature that
Oh, okay.
allows anyone to flag the alarming content to the social network. Twitter and Instagram also
Hmm.
have warning measures in place if the content seems like somebody is going to commit suicide. But there's
Hmm.
no much information about how is this, how to do it. Probably, we
Hmm.
can Google and check later how
Yeah.
to use the suicide prevention feature.
Hmm.
Yeah, first thing is I think
I
reaching
think,
out.
yeah.
Reaching out is important.
Yes. Yeah. Since you mentioned about reaching out, I'd like to know from you, how can we actually reach out to people? Because we can't directly say that, oh, hey, you can't do this. Maybe it might even trigger them or maybe overwhelm them. So, what are the correct kind of questions that we can ask to a person that we are reaching out to and maybe just show concern or just show them support related to their mental health?
Okay, so the first thing is when someone tells you, first of all, they are
Hmm.
confiding in you and telling you probably one of the most private thing about ending life. It's not.
Yes.
It's something that active. It's not like they're saying that doctor told me I have cancer. I'm going to die in 2 months. That's very very different
Yeah.
from them expressing their wish, and it might be very
Hmm.
overwhelming for you. Put yourself in that
Definitely.
position right now. Let's just say I'm talking to my friend and I'm trying to catch up, and my friend tells me, I'm having these thoughts and I'm feeling like acting on them. First thing is you are
Hmm.
definitely overwhelmed. So it's easy when you're overwhelmed to talk
Definitely.
things without actually giving a thought. Um,
Yes.
so
Yes.
you, as a person, take a minute. Try to take some deep breath and come to the reality and try to understand the gravity of the situation and then respond. Do not
Hmm.
impulsively say what is wrong with you. Usually we tend to quiet that person. I'm sure like a lot of us
Yes.
have done it, without knowing, with good concern, of course.
Yes.
We might tell that,
Yes.
shut up, what is wrong with you? There's nothing wrong with your life.
Hmm.
I know people who have bigger problems than you. Don't talk these kind of things. The moment you say don't talk
Hmm.
these kind of things, the other person, first of all, gathered so much courage to express what they're feeling, hoping there'll be
Hmm.
validation, hoping there'll be some kind of support. But you are trying to mute the person with
Yes.
good intention,
I
even though
agree.
you're a good person, even though you're best of the
Hmm.
friends. Or you might tell things like, think about auntie or think about uncle, what will happen to them.
Yeah.
So understand
Hmm.
this is not about uh, other people. This is about this particular person who is asking you for help, right? It's
Yes.
only and
I
only
agree.
about them.
Yes.
It's not about, what will happen to auntie or uncle or what will happen to your children, spouse. None of that should matter. I
Hmm.
mean, at that point,
Yes.
you should only talk about them and ask them open-ended questions. Do not ask, uh,
Hmm.
did you buy any pills? Yes or no?
Hmm.
Did you,
Yes.
tell this to anyone else? Yes or no? Don't do that. Let them vent out. Sometimes speaking out gives a lot of clarity for their own good. In India, we don't have too much of a
Yes.
hobby of
Definitely.
journaling. Journaling actually helps in understanding your
Yeah.
thoughts. We don't do that. A lot of us don't do that. So we talk. In India, we love to talk to people. So don't ask
Yes.
them any closed questions. Ask them open-ended questions. Let them speak how much they want to. Don't show any
Hmm.
judgment. It's always like, but we always tend to give our expertise in the situation that is not required. I
Hmm.
think we don't have to.
Yes.
When someone is telling
Yeah.
that I'm not able to forget my ex and I feel like I don't have a life without him or her. Then you'll end up saying that, what is wrong with you? He or she is not worth it. When will you realize it?
Hmm.
You know,
Hmm. Yes.
there is no solution. You're not there to give solution for them. Just talk to them and
Hmm.
let them know that you're there with them. And
Yes.
one more very important thing is, once a person calms down, um, when he or she is better, next day
Hmm.
or whenever it is, check on them. Most of us don't check on it because
Yeah.
we are like, okay, you know what, I succeeded in, like, stopping that attempt, and
Yes.
we are good to go. I'm glorious and victorious. Then, no, that's not going to happen. The thoughts might come back.
Hmm.
The support you gave could be
Yes.
just very temporary at that moment, right? Talk to them
Hmm.
and don't show
Yes.
sympathy. A lot of people don't like sympathy, right? Whatever
Hmm.
you're saying,
Yes.
whatever you're doing, do it out of genuine care and concern. If you think you don't have capacity to do that, as a friend, like some of us
Hmm.
don't have such
Yes.
emotional intelligence to do these things, put them to a counselor. Let them talk out, you
Hmm.
know. But at the end of the day, please get a professional help for them. That's very, very, very important. We have I
Yes.
have a couple of friends. I mean, I have a lot of friends. For their birthdays, I usually give them a mental health assessment. I book a mental health assessment for them. That's one of the birthday gift I
Okay.
give them. It's
Hmm.
not me trying to be different. It's me understanding that all my friends are doctors. So I think doctors are by far
Hmm.
like one of the most stressed out people, and even suicides are very, very common in population of doctors. For people who don't know that,
Hmm.
especially the ones in emergency medicine, who is
Hmm.
doing back-to-back surgeries or psychiatry, these professions are more prone. So I give most of them like mental
Yes.
health assessment. I book consultations for them because they might not open up to me because I'm their friend.
Yeah.
It's better to send them to a
Yes.
neutral person. So I think these kind of simple things are important. What do you think? I
Hmm.
mean, do you think anything else would help?
I think you very beautifully mentioned about reaching out and also asking them about it. We tend to just feel that, okay, our job is done. If we have just said one message and just say, I'm there for you. We have this tagline, I'm there for you. But are we actually there for that particular person? Are we actually checking them after that particular situation? So I think that is very thoughtful, and thank you for explaining that, doctor.
Yeah, and
So
one
moving
more,
on. Yeah.
sorry, one more
Yeah.
thing is, if
Yes.
somebody tells that, gives you a hint. A lot of them might not tell you that, I want to end my life. They might say, this pain is so much, I'm not able to bear it. I just
Hmm.
feel like disappearing. I feel like not existing anymore. I want an escape and never return back. These kind of things are also a red flag that, hey, that's what
Hmm.
they are talking about suicide. What happens is there's a big myth. I Googled yesterday what are the common myths about suicide. They say that by
Yes.
encouraging someone to talk about it, they might act on it. That's not true at all.
Hmm.
That's not true at all. By encouraging someone to,
Yes.
for example, if you talk about COVID, you won't get COVID. So same
Hmm.
way, I think if you,
Definitely.
if you encourage someone to talk about how they're feeling, I think the chances are that feeling will only die down. That's what the science
Hmm.
says, and my
Hmm.
experience also says. So, talk to
Hmm.
them. Open conversation. A lot of us don't. We brush all our problems under a carpet, and we look at the pretty carpet outside. That's not correct.
Hmm.
The way to
Yes.
do it is, like I said, I felt at one point in my life that I don't want to live anymore. It just doesn't, like, nothing makes sense,
Hmm.
especially if you lost a parent, if you lost someone who is very dear to you. In fact,
Hmm.
yesterday I was seeing this patient. Obviously I will not bring the name. um, so she was talking to me. I think after a long time, I got affected by a particular patient. Usually,
Hmm.
doctors have a kind of a cold heart because we see so many patients, and pain is a very
Yeah, I
normal thing
understand.
for us. She told me that she lost her father 2 months back to COVID. I told myself, okay,
Okay.
you know what? It's a very bad place, but at least her family, other family is there. I asked her, "How are you and your mother doing?" She said that I
Hmm.
lost my mother when I was a child. Somehow it's, I mean,
Hmm.
I saw many patients who came to me before saying they don't have both the parents, but this one somehow broke my heart. I was just feeling very vulnerable and bad. So why I'm bringing up the situation is, sometimes when people talk to you about how they're feeling, right?
Hmm.
It
Hmm.
it's not contagious, but it might bring up unresolved conflicts within your own self also. So
Yes.
once you help them out, try to see if you are okay. That's important.
Hmm.
Some
Definitely.
of us bear the brunt of everyone else. We take it. We take, one of us take it for everyone else. We have a burnout. So if you're
Yeah.
somebody who is helping someone who is depressed or feeling suicidal, make sure your mental health is all right too, and you are in a capacity to help. Because there's no point if
Hmm.
that person goes on to live and you feel depressed and you might end your life. That's not, because I know this happens a lot more than
Yes.
what viewers know. So take care of yourself
Yes.
as well through this process. Yeah.
Yes. Thank you, doctor, for that wonderful explanation. Moving on, I'd like to know from you that many of us think that when we have these suicidal thoughts or giving up, this is the last resort to our problems and difficulties. Suicide is the last resort. So, is it so, or there is still like a brighter side of life that we can hold on to?
Obviously, there are no prizes for guessing my answer. It's never, it's not last, not first. It's never a solution, right? We never came
Hmm.
into this world on our own, and we can't go out of this, world on our own. And it might sound
Yes.
philosophical, but what I'm trying to say is, it's all about perspective. If you think your
Hmm.
life is crappy, it's full of problems, that's how it's going to look like to you. If you feel like, what,
Yes.
it's bad but it's okay, what, I'm going to live through it. I think telling, there's a little bit of self-talk or pep talk. I give myself this whenever I have problems. Usually I'm a very private person, I might
Hmm.
not tell too many people how I'm feeling. So I
Hmm.
tell myself, I give that pep talk that, what, it's very difficult, but you know what, you're going to get through this. I think
Get through.
how
Definitely.
uh, this is not a proverb or some saying, but just know that every problem has a solution. The whole point why it's called a problem is because it has a solution. Even in English,
Hmm.
when you look
Yes.
at it, that's why it's called a problem. And
Yes.
solution is not never one. You have multiple solutions. You just have to use your logical part of the brain and get to it. When you get to it,
Hmm.
there are so many solutions. Some might take a long time.
Hmm.
Some might be like immediate relief, right? So yeah, I mean, I think it's uh, never a solution. Never, never.
Yes, definitely. My last question for you today is what should be done if a friend is contemplating suicide?
I think a mixture of whatever I told before. But first, most important thing is, just be there for them. Um,
Yes.
like one of my friend was
Hmm.
last year this happened. Lost both the parents and was very vulnerable. Had a divorce and
Hmm.
miscarriage and multiple. Sometimes too
Yes.
many things happen at once to you. You just feel like giving up. You just feel like
Hmm.
there is no ray of hope. There is no sunshine. It's so depressing. Everything I'm touching is turning into ash. That's when you'll feel like, um, I don't want to live anymore. So I
Hmm.
I took that friend. I went on a trip. Uh, in the trip, it's not like, I was trying to, help them escape. I'm not looking at the temporary escape for them. I don't want to give them some
Hmm.
great trip before they end their life. No, that's not the intention. I asked them to just talk to me or just be there with me. Just be there. Sometimes,
Yes.
like me as a person, like if somebody is there in the room doing their own thing, but they're just there, the physical
Hmm.
presence is enough for me to feel better. Sometimes I just need
Hmm.
someone to just be around, right? So I
Yes.
packed my bag and went and lived with that friend even after we got back from trip for like 2 3 days. We didn't do anything actually.
Okay.
That friend didn't want to talk too much in the beginning, so I didn't. I was not playing a doctor or
Okay.
psychiatrist there.
Okay.
I was just sitting and
Hmm.
we were cooking, we were baking. Sometimes I think you have to show them a slice of life. Uh,
Hmm.
let them know that there's so much there, that they can do with their life. They know it. They already know it, but
Yes.
that time your brain is so shut off from every other door. The only door you see
Hmm.
is like, to heaven or hell. You just want to end their life. So I think
Yes.
that's one important thing. And most importantly, don't be curious. Most of us are very curious. Why? What
Hmm.
happened? That's the first thing. If someone comes and tells
Yes.
you that, I lost my father, people usually tell that, why? What happened? You know,
Hmm.
don't ask. Maybe the pain is so much they don't want to tell. Just give a hug and just be there. No, how difficult it is.
Yes.
Why are we such curious people? Why do we need to know reasons? Some of
Hmm.
us trying to investigate. Show me, do you have any weapons here? Don't. You are supposed to
Hmm.
be a shoulder for them. You're supposed to be a friend. That's very important. Don't be judgmental. Don't ask questions. Just listen. Simple things. I think just be human, be sensitive.
Hmm.
Imagine, see,
Hmm.
in life,
Definitely.
it's a little philosophy. Sorry for that. In life, I always put myself in other shoes and see that, okay, would I want to be treated like this? It's
Hmm.
very easy,
Yes.
right? You don't need some psychiatrist telling you what to do, or you don't have to read some great blogger writing about how to help a friend. uh, I think just
Hmm.
being honest in your approach and understanding that if I feel the same way, what would I expect out of my friend? The same thing you have to do for your friend. That's pretty
Hmm.
simple, I guess.
Yes. Yeah. Now, I'd like to take a few questions from our viewers, and we have a couple of them, but due to time constraints, we'll just take a few of them. One of the viewer asks that such thoughts are more among teenagers. So, how can we prevent these thoughts, especially catering to teenagers?
I think teenagers are very impulsive, by nature. That's when they suddenly the body
Hmm.
is exposed to a lot of rush of hormones from their brain. So generally, most of the teenagers are, impulsive. So one important thing is family support is very important here. Um,
Hmm.
I work
Yes.
with a medical college also, so I have a lot of 19 or 18-year-old kids coming to me telling that many times they wanted to end their life, but they couldn't for whatever reasons. I asked if your family knew about it. They said, yeah, they all are aware. When I asked them, but did they get you the help that you need? They said that don't humiliate us, or
Hmm.
nobody did these kind of things in our family. Again, these are loving parents. These are normal, regular loving parents. These are not some toxic parents, right?
Yeah.
They just don't know how to
Hmm.
respond. I think most of them are like, you don't have to go see a psychiatrist. You don't have to go see a psychologist. It's just start being positive. Think positive.
Yes.
If somebody can think positive, if it's that simple, they won't be there. I think
Yeah.
getting help is
Definitely.
important, and family support is very important for teenagers. And most of the teenagers, they're scared of judgment, and teenagers are very
Hmm.
judgy
Yes.
also. Like they can judge very easily. The first thought that they can think about someone, they would just pass it. In fact, most of the teenagers are very nasty to me on social media also. Most of them are teenagers. When I see them, if I don't respond, they're very impulsive, right? If I don't respond to their text immediately, they're like, they backlash at me, right? So
Yeah.
yeah, I think the community of teenagers should be more patient, more assertive, more perseverant. I think that will help them. Yeah, I guess I don't know if I
Yeah.
answered your question, but
Yeah. Thank you, Dr. Charan. We have another question. Feeling like there's no goal in life, is it the first step of being suicidal? And they have written more. Uh, yeah, like there is no will to live. Is that the first step of being suicidal?
yeah, I mean, usually hopelessness leads to suicide. When you feel like I don't feel like I told about this particular person, right? Had multiple stresses at once, and they don't see any hope. It's just that, I think if they breathe for 5 minutes when the thought comes and they're about to act, I think that thought will go down. That
Hmm.
suicidal thought
Yes.
usually, I'm not saying always, usually comes like one impulse and it goes off for some time. If you can postpone or
Hmm.
procrastinate or stop that impulse, I think you are a survivor by yourself. I think that's one
Hmm.
important thing.
Yes.
And also, I think when you spoke about teenagers, the most important thing I forgot is having suicide awareness programs in school. When I
Hmm.
was doing
Yes.
my MD in neuropsychiatry, we were attached with like many schools around, many government schools and NGOs, etc. None of them even knew like what is suicide, right? But a
Hmm.
lot of them, when we were PGs, we were like 18 postgraduates. We went and spoke to them, and they said that, yeah, I felt many times like this, doctor. But I thought,
Hmm.
like, who will be there for my mother if something happens to me? That kind of faith kept them going. But my problem is the same kid who is feeling suicidal and want to stay alive for his or her mother. What if mother dies because of some reason someday? Then this
Hmm.
person will not find
Yes.
any more will to live, right? So I think
Hmm.
having an
Yes.
awareness programs in the school and just like what we did, right? Probably if we
Hmm.
could go and do in schools in rural areas, people who can't reach on Instagram and all these things. I think awareness is
Hmm.
important. A lot of, like I said, we can do a skit or role play about how to enact somebody came and told you that I want to end my life, and how would you react?
Hmm.
I think
Yes.
something like that would help.
Yeah. You mentioned about schools and suicide prevention programs. I think we can also have that in organizations as well. We can conduct such lives because there was a question related to how can we make a collaborative environment and a more suicide prevention space in organizations. So I feel that suicide prevention events will be helpful in catering to that, right?
Yeah,
Or is there any other
no, no,
suggestion?
of course they do. I think two things that need to be changed is Suicide Prevention Month happens once a week, one
Hmm.
happens once a year,
Yeah.
right? But I
Yes.
think once in a month or once in 2 months, I think screening is important, because if you look at NGOs, if you look at like this, I don't want to mention, but I think some organizations, sexual abuse is very, very common in children. uh, People
Hmm.
who take care of
Yes.
them only like sexually abuse them and things like that. Like because I worked with many NGOs when I was a PG, I know it. It's much more than what we read in the papers or what come to the forefront. You know,
Hmm.
so I think going and doing these programs very often, like once in 2 months at least, not every week, once in a month or 2 months,
Hmm.
would be very very helpful, because a lot of people would be willing to open up. How many people from NGOs can
Yes.
afford to pay and come to me in because I work in a
Hmm.
super
Yes.
specialty hospital. It's a top hospital in Hyderabad. How
Yes.
many can come to me? Right? Where is the
Hmm.
help? Like
I agree.
how can you bridge the barrier between me and someone who can't afford me? I'm being honest, right?
Yes.
It's like the bridge is too much. So I think if you can bridge that gap, I think that'll be helpful. And second thing is suicide prevention helplines are very bad in our India.
Hmm.
Right? Last year I was
Yes.
doing a talk, and where we were discussing my friend who went to Singapore. There is a bridge where people usually jump and kill themselves. So on that bridge, they put a lot of signboards saying that I'm here for you or whatever things like that. I think when they're driving by, seeing so many positive this thing, they see it as a sign from the God, and they feel like, okay, you know what?
Yes.
Simple things. Where is our government thinking
Yeah.
these kind of little things?
Hmm.
I think
Yeah.
helplines. I gave some 10 helpline numbers, and a lot of patients told that none of them worked.
Oh, okay.
Yeah.
Okay, doctor. So now I'd like to conclude this session by giving the platform to you again. So if there are any concluding remarks or any kind of experience that you want to share based on the theme, so over to you.
Um, I think I'll tell you very simple thing. Like I myself had clinical depression when I was a adolescent. I was treated for it. At that time, I felt like this world is such a like terrible place to live in. Why should I even want to
Hmm.
live anymore? I found no. I mean, I didn't act on it or anything. But then I didn't. I was like, okay, you know what? I would get up and I would just like get on with my day, and I would wait for the day to end. There was no reason.
Hmm.
But when I got treated after like that went on for over an year, and after that, when I look back and I thought that I was thinking like those problems are not really big. I imagine them to be so
Yes.
big in my head. Actually, no problem is big. Even
Hmm.
losing both your parents, I know it's the most traumatic thing, but we should know to live through adversities. That's human. That's the only way we can live a life, right? We
Hmm.
make more connections, we lose some connections, and we make more connections. That's why there is a system of
Yes.
marriage, children. I mean, all these are there because our mental health is active, and we are part of the society, right? I
Hmm.
think when you get these thoughts, try to get through them and go back and assess yourself that were those really such big problems? They're not.
Hmm.
So,
Yeah.
I think I would like to conclude on that.
Hmm. So thank you, Doctor. And on behalf of Peakmind, I would like to extend my heartfelt gratitude and thanks to you for accepting our invitation and joining us in the session. Thank you, Doctor, for giving us your time.
Thank you. Have a good day. And you guys are doing a great job. Continue at it.
Thank you. Thank you, Doctor. With this, we come to an end of today's live session. We would like to know your recommendations also. So if you have any kind of recommendations for us, if you want us to host such lives, please let us know in the comment section. Thank you again, Doctor, for joining in.
Thank you. Good day.
Thank you, everyone, for watching.